Hello, everyone. This is Dr. Melanie Gray with another episode of Code Calm, the podcast that gives you tools to manage the stress in your life. Whether you're a formal leader or an informal leader, this podcast is for you. Today, I am so blessed to have as my guest doctoral candidate LaTivia Carr, who is a board-certified nurse executive, fellow of the American College of Healthcare Executives. She's a certified executive coach, and she is the author of an Amazon bestseller called The Chrysalis Calling, and it is a book you want to read as leaders. I really recommend it for the emerging leader and the experienced leader. LaTivia, it is my good pleasure to have you today.
Thank you, Dr. Melanie. I am grateful to be here. Thank you for the opportunity.
So let's get into it. LaTivia, what stressors? You manage a rather large team. As a chief nurse, vice president.
Absolutely. So from a size perspective, with my role, directly and indirectly from nursing, I have a nursing team around 600 nurses. However, as a member of the executive team, part of my responsibility is for the team at large. And so that would include about 1,500 teammates total. And when I think about what are the stressors, I'm looking at those that are external and internal. So externally, right now, just in our society, there is so much happening that is having impacts on our teams that we need to be aware of. The rising costs of both fuel and groceries and cost of living continues to raise. And that is something that I will be honest in saying keeps me up at night, especially when I think about how that impacts the team that I lead and their ability to be able to care for themselves and their families. How that plays out is we have teammates who are either risking a little bit of burnout by picking up maybe too many additional shifts to try to make those ends meet, or we have some teammates who are experiencing some emotional distress because of all of the pressures. We have teammates of all demographic backgrounds, and so all of the things that are happening in those spaces are also stressors that are impacting our teams. And as we continue to look at a looming nursing shortage, I am acutely aware that despite our best efforts to recruit and retain top talent, there is just not enough in the pool for us to be able to close the gap efficiently. And so we find ourselves, just doing the very best that we can. While I don't have a nursing shortage per se here at West Dallas, I know that it exists, and I know the impact that it's having on our society and our ability to care for our community. And one last thing that I will say is starting to show is all of the decisions that have been made as it relates to how we fund government programs that support mental health are now showing up in our inpatient healthcare spaces where we may not have the appropriate training or care setting to be able to support these individuals who were being cared for in facilities that are lost funding and are now closed.
When you consider, you are keenly aware of the societal impact, the community impact, the world impact. People just don't leave their lives at the door. And you said that it keeps you up at night. How do you manage that? How do you manage your sensitivity and caring and still balance your emotions and maintain accountability?
100%. That's a really good question because it is really easy to get lost in the emotions and have more sympathy than empathy when dealing with teammates who are facing some of these difficult challenges. And so one of the first things I do is I try to take a step back and as as easy as it sounds, is very hard to do, but taking the emotion out of decisions that need to be made, right? And so just like when you're driving in your car, the yellow light is there for a reason. The red light means something. So we have these in our world policies and procedures that guide our practice. And so how I'm able to move forward is that I make sure that as I'm leading these teams with empathy, understanding that there are a lot that they're facing, asking more questions, trying to seek to understand first, listening with intent. And I think about assuming positive intent as well. And then as it's time to, hold accountability, that includes three things. Were we clear with our expectations? Did the person on the other end commit? And then that we share the consequences should the steps that were asked to be followed not followed. And I pride myself on ensuring that I do those things because I can hold folks responsible. They must hold themselves accountable.
I love that they have to hold themselves accountable. Now, your leaders, you have, 1,500 people. So you have leaders that you then must coach to care.
Mhm.
Are there any challenges in that you're in helping or encouraging your leaders to have the level of compassion that you'd like them to exude in the culture for their teams?
Well, one of my favorite quotes is be the change you wish to see in the world. And so, how I do that for my team is I model the behaviors that I am expecting of them. And as they see me model, they see how I care for them, they see how I listen to them, they see how I support them. That's what I'm expecting of them as they lead their teams. And for me, by being that example, it makes conversation easy around what are your thoughts on how you should approach this? And I'm grateful that I have a leadership team that seeks me out to say, here, hey, LT, here's what I'm thinking. And I just wanted to run it past you, not because they want me to tell them what to do. I think that they want to share it with me because they want to show me like, you're making a difference. How you lead matters. And I want you to see that I'm thinking along those same lines.
So, when do you find that it's more difficult given the multi generational team that we have? And so the older people, the boomers, who want to talk and meet. Let's talk it out. And you have the younger ones who like, no, just send me an email. So how do you bridge that generational gap?
They are different. So the first thing I do is I seek to understand, right? So we have 5 generations in the workplace, all with different morals and principles. And so myself understanding the different nuances and how to reach each generation is important because how I talk to a millennial or how I talk to a Gen Z is going to be very different than how I talk to a Gen X or how I connect with a boomer. So understanding those things helps ease that connection and remembering that my value system doesn't have to be your value system in order for us to be successful together. I tell my clients all the time when I'm in the coaching seat, do you want to be right or do you want to be in relationship? I'm not seeking to be right. I'm seeking to get it right. And so because those things are aligned, it helps us move forward.
Well, I love that. Do you want to be right or do you want to be in relationship? What's the response to that? Because very often people want to be right.
People want to be right. And
There's a
so
song about that too.
more often than not. But I think what that question does is it helps them pause and think about it. Because most of the time when I'm asking individuals that, it's like they have to do that intentional pause. And when I ask the question, I just give space and wait. And there have been times
And
where people have said, well, I want to be right. Okay. How is that going to impact the relationship? How does that help the goal that you're trying to accomplish?
that's excellent. Would you say that's a code? Asking the question, do you want to be right or do
That
you
is
want to be in relationship?
that is
Would that be
definitely a
one of your
code.
codes for calm?
That is definitely a
Definitely a
code.
code.
Definitely. And it's a code that I apply as well because I'm a human being. And so there are times that as executives, we challenge one another. We're in these roles and in these positions because we know things. And we've had some experiences that helped get us here and that the organization has trusted us to utilize and leverage to lead teams. And with that comes look, everybody's got ego. But at the end of the day, what's most important for me and what helps calm my heart and regulate my nervous system and ease my mind is that my ultimate goal, one, I believe that we're all here for the same thing. We want to do our very best for patients. So I put that first. And assuming positive intent, I believe that the intent here is all about the patient. You're not trying to make me look bad or make someone else look bad or, throw me under the bus, so to speak. And so I'm always going to seek to create the relationship and preserve the relationship over proving my point. Because the thing is, if I'm right, I'm right. And I don't need anyone to validate that.
Mm-hmm. Mm-hmm. So you also spoke when we began about the fear people have. A fear of loss is also very present because people are afraid of losing their jobs because of the economy. They're afraid of AI, and everyone wants to move up. And there are fewer opportunities to be that CNO. Right. I began my career in my community. There were like 15 community hospitals. That was 15 opportunities for leadership. Now we have about 3 or 4 systems and that have local sites. So how, one, do you deal with the code around calm when it comes to people want to grow and to elevate, as well as that fear of loss because of the continual mergers and changes?
You're right. It's a very real thing. As we continue to get wide, that vertical row becomes even more narrow, right? And those are realities. However, the opportunities are still there. So helping individuals identify their strengths and being honest with them about where they need to grow. I think one of the biggest mistakes that we make as leaders is we try to protect individuals from the truth. And so I am very candid with leaders when they share with me where they want to go. And here is what I believe you will need to get there. And I'm also intentional about connecting them with individuals that can help them if it's not me, because I am not the expert in everything. So let's find you a mentor in that space or someone that you can connect to learn more about it. And I've had it go both ways. I've had it where leaders or individuals who wanted to continue to grow connected with a mentor after having that honest conversation and they wanted to do the work. And they got in there and decided that I don't think that that's really what I want to do. And that's leadership, right? I said, well, now you have just grown another rung on the ladder of leadership, because the first thing that you should recognize as a leader is where your strengths are and what you're really passionate about, and connect the work to that versus just chasing after a title. And secondarily, the other piece of that is, what are the steps? The only place you see success before work is in the dictionary. So what are you willing to do? What accomplishments, what achievements, what schoolwork, what certifications are you willing to acquire in order to get you there? I'm finding that, especially in some of the generations, they want to jump from the ridiculous to the sublime overnight without putting in any additional effort to get there. And there's a reason why you're Dr. Melanie Gray and I will soon be Dr. LaTivia Carr. We've put in the time and the work and the discipline to get here. We've learned, we've lost, we've made mistakes. And that's all a part of the leadership growth and development journey.
I believe that is a code for calm. When you
Yes.
understand what it is you need to do, the path that you need to follow to become what you want, and to give yourself a chance also to look at yourself and determine
Yes.
as you grow, is this something that I want? My mantra is to encourage people to look at the life they want to live and then
Yes.
plan their career around it.
That's it. I've had that conversation with all of my children. And even as they look at my life, like, you see mom and dad, now you think about what we've had to do, and you've had a front row seat to the work that it's taken to be able to do the
Mm-hmm.
things that we do. So I love that, Dr. Melanie. Look at the life you want and then plan your career around that. And then you won't be disappointed. And I love that you said plan. I do talk about that a lot in my book in terms of, I think about the scripture in Habakkuk 2 and 2, write the vision. And after
And
you
make it
write,
plain.
for in the end it shall speak and not lie. Though it wait, though it tarry, wait for it. For in the end it shall speak and not
Mm-hmm.
lie. So first you got to write it down and be intentional about what you're writing. And don't put limits to it. When I think of limits, it's put a time frame around it. So I would have notes on my refrigerator. I will graduate with my bachelor's degree by 2004. That was a date on my refrigerator. And then, beginning with the end in mind, as Stephen R. Covey would tell us, I looked at what are the steps that I need to be able to do that. Okay, now how do I go about accomplishing these things? What do I need to do? At the time, I was an associate degree nurse, so I knew that I would have to enroll into a RN to BSN program. I looked at the courses I would have to take. Okay, so now we've got the courses. Now we got the plan. I knew that, okay, I have 2 small children. I'm going to still need to work and maintain my home. So what is the work schedule that I'm going to have to maintain for these next 18 months so that I can finish this program and map it out and then be intentional about accomplishing it?
Yes, I love that. You have to be intentional. And so, as we get ready to close, LaTivia, can you get reinforce to the listeners your code for calm, and then two, tell the listeners how they can connect with you? Perhaps there's a leader out there who needs some executive coaching, and they're gonna want to find you.
Thank you, Dr. Melanie. So if I could recap my code for calm, the first one is recognizing that I would rather be in relationship than being right. Assuming positive intent and living by those 4 agreements is definitely a code for calm. So once you remove all the emotion out of it and you're able to self-regulate, then you're able to bring it down. So I would say when in conflict or in situations, preserve the relationship over being right. The only person you
Mhm.
have to prove something to is yourself. And secondarily, when we think about how we lead teams and getting teams on board and helping them to lead with the same level of empathy, you have to model those things. So being the change that I wish to see, modeling the behaviors that I expect to see in others that I lead is probably my biggest strength. And I think the last one would be if there is something that you seek to accomplish, understand what it is, identify your goal, write it down, make it time stamp it of when you want to achieve it by, and then in between that space map out the steps that are needed to be able to accomplish that and then move forward.
Mhm.
And
Mhm.
those would be, I would say, things that we have pulled out in this conversation as some of my codes for calm, for sure, at the top of my list. And if individuals would like to reach out to me first, you can buy my book, which is titled, you see this one I've been reading, The Chrysalis Calling, How Life's Lessons Shape Authentic Leadership. It is available on Amazon and barnesandnoble.com. And you can reach me at transform at butterfly effects with an A, LLC.com.
Well, you heard it, everyone. It's better to choose if you want to be right or in relationship as the code for calm. LaTivia, thank you so much for being with us today. And if this episode resonated with you, please leave a comment. Please like and share Code Calm with Melanie Gray, Ph.D. RN. Make it a great day and remember to live healthy and live well.
Thank you.